Hi there, and welcome to Dr. C's Morning Minute. I'm glad you're here. I had a question from a viewer indicating what the question was. I'm having concerns with my child. I'm concerned that may have autism, and I'm thinking about having him evaluated. What happens during the evaluation process? Now, that's a great question. I'll walk you through my evaluation process with a parent and a child. Most of my colleagues carry out an evaluation in similar fashion. First, it should begin with an interview with you, of course, to obtain a thorough developmental history that includes questions about any complications during the pregnancy and delivery, early development and milestones, illnesses, and when you had your first concerns about your child's functioning. There should be a discussion about how your child's functioning has progressed or regressed over the course of time. The interview should then move into how your child is functioning at this time, focusing on how well your child can communicate, socialize, play, manage frustration, follow directions, and handle community outings. You'll also be asked questions about your child's sleep and appetite. It'll be important to target any odd behaviors that may have been seen in the past or are observed now, such as toe walking, bouncing, hopping, spinning, lining up objects, becoming obsessed on various topics or objects, unreasonable fears, sensory sensitivities to fabrics or sound, indifference to pain, appearing off in his own world, among others. I prefer that the interview with the parent be conducted separate from the child. For example, I'll have the child playing in a playroom directly adjacent to the evaluation room where I'm talking to the parent. The reason for this separation is that I try not to discuss these concerns in the presence of the child, who may find it unsettling to be talked about right in front of them. However, at times we can have such a discussion if the child is especially young and demonstrating limited awareness of what's going on around them. The evaluation then transitions to the parent completing some behavioral forms. And the parent will do this while I interact with the child. This interaction with the child could take any number of forms, but preferably involves me sitting on the floor with the child, becoming involved in whatever he or she may be doing at the time. During the interaction, I'm assessing any number of things depending upon the age of the child. This could include general engagement with me, ability to warm up over the course of time, eye contact, ability to model and mimic me, response to name, play skills, ability and willingness to follow directions, awareness of his surroundings, capacity to communicate, academic skills, intellectual functioning, any obsessive or compulsive tendencies, and other odd behaviors such as toe walking, hand or arm flapping, bouncing, or spinning. I may also utilize the parent to interact with the child to see any difference compared to interactions with me. The evaluation process often also includes discussion with others having contact with the child, including teachers, speech and language occupational therapists, to obtain their perspective and feedback regarding the child. After spending ample time with the child, I then meet with the parent again to discuss my formulation, diagnosis, if there's a diagnosis, and explain the course of action, treatment plan, and provide ongoing guidance. I then prepare a comprehensive report that is mailed to the home for review. I then follow up with the parent and child as needed to provide further assessment and guidance. I also talk to any subsequent service providers to coordinate services and the treatment approach. Okay, that's a brief overview of my evaluation process. I hope that helps to answer your questions and obtain a better understanding of what to expect. But keep in mind that the evaluation process should be reassuring in that even if there is a diagnosis provided, which obviously can be quite stressful, you're given a thorough understanding of the scope of the problem, how the problem is going to be resolved, how to access resources, where to turn for ongoing help, and that the psychologist is available for ongoing support. In that respect, I'm available to answer such questions at jcrosso@cpcrecare.com or drc@autismcenterpittsburgh.com. I hope that helps answer that question and come to a better understanding of the evaluation process. Hope to see you next time at Dr. C's Morning Minute. Thank you.